So I'm Kate Mealy. I'm an obstetrician gynecologist, and I'm a medical officer in the CDC's Division of STD Prevention. And I'm also adjunct faculty in Emory's Department of Gynecology and Obstetrics. And I will say that I met Noor last year at IDZOG before she landed at Emory.
I'm Noor Shibley. I am one of the maternal fetal medicine fellows at Emory University in Atlanta, and I'm excited to be here with you today. So Dr. Mealy, one of the things that we wanted to learn a little bit more about, and if you could update us on, what are some of the main concerns that we're seeing with syphilis in the United States right now?
Sure. I think we can all agree that there is just so much syphilis. So we're all seeing increases in syphilis and congenital syphilis in our communities, and I wish I had tracked the number of texts that I get from my very smart MFM friends about syphilis over the years, because I feel like I could have easily predicted where we are today just based on the number of questions I get from people about syphilis management. So right now in the United States, we are continuing to see drastic increases in syphilis and congenital syphilis. And the reason that we're here today having this conversation is because our 2022 data showed that our congenital syphilis case rate was up to 3,755 cases. And I think we can all agree that every single case of congenital syphilis is a public health failure.
That is a huge number of cases, Dr. Mealy. I read somewhere that the rate of cases has increased like in the last 10 years over like 700%, is that right?
Yes, that's exactly correct, Nora.
Some of the interesting things I've learned about syphilis is that it can cause so many different complications in pregnancy, not just pregnancy loss and stillbirth, but also neonatal or congenital syphilis can cause increased rates of blindness, deafness, developmental delay, among other things.
Yes, absolutely. And you also have to keep in mind that with all of our data, we always vastly underestimate the impact on miscarriages. And that's because what we know as OBGYNs is that it's so hard to capture the number of miscarriages because people often don't present for healthcare. They may not present for healthcare knowing that they had a pregnancy complicated by syphilis. And so those numbers are also vastly underreported. But just to repeat what you said, which was absolutely correct, is that with syphilis during pregnancy, we're seeing those increases in stillbirths, increases in neonatal deaths, and increases in preterm delivery. And then of course, also the long-term sequelae from congenital syphilis if it's not treated properly.
So what are some of the things that we need to be paying attention to as clinicians in helping reduce these numbers?
Sure. So I also think that as people who are taking care of people who are pregnant, need to keep in mind is that we also need to prevent those long-term impacts for people who are pregnant and then go on to be postpartum. And those long-term sequelae of syphilis are devastating. So people can suffer from permanent hearing loss, permanent vision loss, and neurologic changes. And ultimately they can suffer from problems with their cardiovascular system, usually their aorta. And what you might not know is that syphilis increases your risk of HIV acquisition as well as HIV transmission. So that's something for us to keep in mind so that we can better care for our patients.
So given these exceedingly high numbers of rates of congenital syphilis, what are some of the missed opportunities or things as clinicians we can focus on?
Sure. So, in November of 2023, CDC came out with a new report. It's a CDC vital signs report on missed opportunities to prevent congenital syphilis. And one of the things that we found was that at least 90% of cases of congenital syphilis can be prevented with timely testing and timely treatment. And the thing that's really interesting for me about that analysis is that it really flipped on its head our prior paradigm for how we think about missed opportunities for preventing congenital syphilis. So in past analyses, we had always said that in order to prevent congenital syphilis, someone has to have prenatal care. And what we realized recently by looking at those numbers from the 2023 report is that prenatal care cannot be a prerequisite for syphilis screening and treatment, because we are not going to win that battle as a community of folks who cares about syphilis. There are so many systematic problems related to a lack of prenatal care access, and instead we need to think about ways to reach people where they're getting their health care. We need to treat every single healthcare encounter during pregnancy as prenatal care. And so the thing that I think about is when I'm on call and I get a call from the emergency department at 3 o'clock in the morning, and it's a call about an early pregnancy complication, some easy question, is that I always remember to say, did you send a syphilis test? And those are the moments where we can change lives. Because by asking that emergency department clinician colleague of ours to send that syphilis test, And then I write it down and I follow it up in a couple of days. And I ask them to also get a phone number for the patient to make sure that we were able to get that syphilis test, follow up the test result, and get them treatment. Because those are the opportunities, that's where people are presenting during pregnancy. And I think the other thing that I always remind myself of is that most of my patients who deliver, even if they've had no prenatal care, they almost always know the sex of their baby, right? Mm-hmm. They know if they're having a boy or a girl. And so they had an ultrasound done somewhere, and there was some opportunity to test them for syphilis.
And in looking at our pregnancies that we're following with syphilis, what are some systemic strategies we can do to make sure these patients are receiving their adequate treatment?
Yeah, that's a great question. So I think the follow-on to what I was saying before is that sure, if we get people syphilis testing and we diagnose them, that's only half the battle, right? Mm-hmm. We also have to get them in for their treatment. Mm-hmm. And that is really challenging. But there are a couple of really amazing opportunities that have presented themselves in the past few years. And one is syphilis rapid point of care testing, which was recently introduced to the US market. There are 2 rapid syphilis point of care tests. One is called Syphilis Health Check and one is called ChemBio. It's a combination syphilis and HIV rapid point of care test. And the nice thing is that these tests, they really only work in people who have not previously been treated for syphilis, because both of those tests are treponemal tests. And as you know, treponemal tests will remain positive for about 85% of people for their life after treatment.
Right.
And it's not an indicator of active disease. But the nice thing is that, frankly, a lot of cisgender women, people who are pregnant, have not previously been treated for syphilis. Mm-hmm. So we're in this sweet spot of time where we can use those tests for patients who are not connected with prenatal care to get them their test and then empirically treat them on the same day as they get their test result. And I think that's a great opportunity for us moving forward. And we'll be interested to see as these rapid point of care tests evolve. We are predicting that they will become more advanced and they will ultimately become a combination of a treponemal test and a non-treponemal test, which will be an exciting opportunity for us to move this work forward.
Yes, that's really exciting. I could see how those tests could be implemented in emergency rooms, labor and delivery triage, and really kind of close the gap with the patients that are lost to follow-up.
Yes, absolutely. And just as a reminder, my personal practice is that for any patient for whom I'm recommending a rapid point of care test, mm-hmm. I also always make sure they get the traditional serologic testing, mm-hmm. because then their next steps in actual diagnosis and further treatment can be based on those serologic test results. And those tests are more sensitive and more specific.
Tell us about the new data that is coming about stillbirth and syphilis.
Sure. So I think, one of the things that we as OBGYNs are really worried about is the increases in congenital syphilis, of course, but also the associated increases that we are inevitably seeing in stillbirths. So CDC has a new publication that's out in the Green Journal as of August of 2024 that's looking at the trends in syphilis-associated stillbirth rates. So we looked at data over 5 years for over 13,000 congenital syphilis cases. And what we found was a pretty consistent about 6% stillbirth rate. Mm-hmm. And so just to break that down for us, that's 1 in 20 pregnancies complicated by congenital syphilis results in a stillbirth. Mm-hmm. And we found those trends to be stable over time, so we don't see a proportional increase related to our overall congenital syphilis case rate. But what we know is that as we are seeing more cases of congenital syphilis, we are going to be seeing more syphilis-associated stillbirths over time, which is pretty terrifying for me. Yeah.
So, as a patient who maybe has experienced a stillbirth related mm-hmm. to syphilis, mm-hmm. what are some things that they can do in the future to prevent?
Yeah, absolutely. So I think that, we need to talk with our... So I think that clinicians are often afraid to test their patients for syphilis in the context of a stillbirth. I think we worry, rightly so, about making patients feel as though they did something wrong, mm-hmm. About making patients feel stigmatized. But what I have found is that for my patients who have a stillbirth, or who have another poor pregnancy outcome related to syphilis, mm-hmm. they ultimately are relieved when they find out there's something that they can pin it on, mm-hmm. because they know that they can then prevent it in future pregnancies. So we need to remember to test every patient with a stillbirth outcome for syphilis, mm-hmm. and then talk with them openly about their test results, make sure that they get their treatment for syphilis, and that they understand what that association was, so that we are appropriately screening them in future pregnancies, which is really all they need is syphilis screening in future pregnancies and timely treatment as indicated.
Absolutely. Anything else you would like to kind of let us know about syphilis in pregnancy?
Sure. I think that as we think about syphilis in pregnancy, we need to empower our patients to help us in the syphilis fight. So for our patients who have pregnancies complicated by syphilis, we need to be educating them about syphilis and encourage them to educate their friends and their family members about syphilis. It's kind of amazing. I've been working at CDC for over 5 years now, and originally started working on syphilis. So for 5 years, my friends and family have been hearing me talk about syphilis. And still, they're kind of shocked that this is what I spend most of my time thinking about, because they don't believe that syphilis is back. It's wild. But the bottom line is that syphilis is back, and we need to be talking about it with our patients. In that November of 2023 CDC Vital Signs, we really encourage that anyone who is taking care of patients in a jurisdiction with high rates of syphilis in their community should be screening their sexually active patients for syphilis. And so we need to make sure that that's happening. I have never worked anywhere where there wasn't high rates of syphilis, so it's hard for me to imagine that would ever be the case. But we really need to be thinking about syphilis screening in addition to screening for all of our other STIs when patients are presenting for care.
All right. Thank you so much, Dr. Mealy, for all your time.
You're so welcome. It's nice to see you, Nora.